Assalamualaikum to Sarush. Today we were going to present about scenario 1 and scenario 2 medical emergencies question. And this is my group member Nora Anna, MS67, Nur Shuhada Asnida, MS66, Rashida Banu, MS50, Lufi Hadi, MS17, Izatul Akmal, MS20, and me, Daniel Shah, MS03.
Good morning, Sarush. My name is Muhammad Lufi Hadi bin Umar Yusof. My meeting number is MS17. I am from Group Jabal Al-Hayyan. My group member is Nora Anna binti Osman, MS67. Daniel Shah bin Muhammad Nazri, MS3. Nur Shuhaida Asnida binti Abdullah, MS66. Rashida Banu binti Abdullah, MS50. Nizatul Akmal binti Ayub, MS20. Scenario Case 1. A 28 years old made Foodpanda rider involved in a motor vehicle crash with a car. He was hit by the car from the back and then fell down on his left side. On arrival, the victim was lying by the roadside, probably moved by the other road users. He looked pale and tachypneic. He complained pain on the left leg. On examination, the victim had hematoma on his abdomen. The left ankle is swollen and movement is restricted. The vital sign is HR 110 beat, BP 16 or 19 or 68 mm, RR 22 brief, SpO2 90%. Question 1. A. Identify possible hazards at the scene and explain your precaution steps taken before you approach the victim. The answer is, when approaching an accident scene, it is really important to ensure your own safety. Look around accident area and place victim being placed any petrol leaking, fire or other vehicle involved with the accident. Be aware of oncoming traffic to ensure that it is not posing an additional danger. Put on vehicle hazard lights and use a warning triangle if there is one available. Quickly establish how many vehicles have been involved. Assess the occupants of all the vehicles to ensure no one has life-threatening injuries. Approach victim by asking his condition next. Ask victim his name. Help victim to identify his condition and call ambulance for immediate medical assistance. I will pass this next presentation to Akak Nora. Thank you.
Assalamualaikum to Sarush and my fellow friends. My name is Izatul Akmal binti Ayub. My metric number is MS20. I will explain the possible injuries suffered by the victims. The victim have hematoma on his abdomen. Victim facing bleeding inside the muscle layer of the abdominal wall. The victim have ankle swelling and restrict movement. Victim facing swelling ankle and movement restrict due victim falls from bike after the car hit that caused his ankle or limb fracture. Ankle swelling is a result from excess fluid can leak and become trapped inside victim's ankle. The victim also have pain in left leg.
Assalamualaikum and good evening, Sir Rush and fellow classmates. My name is Nora Anna Othman. My metric number 67. I'm going to present about question 3. Describe the proper management for the victim at the skin. Number 1. Encourage the victim to not move the injury part. Give a comfortable position to the victim. Do not overcrowd the victim. Check the injured part for swelling, bleeding and wound. Always rise the fracture to control bleeding. Apply pressure on the bleeding site with a cloth circulation. Assess the pulse rate. Stop any obvious bleeding. Administer fluid if available. Initial assessment of victim. DRSABC. Assess the site of injury, size, depth, bleeding pattern, severity, foreign body, contaminated womb, stop or control the bleeding. Disability, assess the neurovascular function, immobilize the injured part, arm sealing, splitting, etc. Expose, check any hidden injury. 11. Immediately transport to the hospital. Thank you.
Assalamualaikum. My name is Rashida Banu. My metric number is MS07190050. Now I'm going with scenario 2. You are a volunteer at one of Pusat Pemindahan Sementara during this recent flood incident in Malaysia. Suddenly, a young lady comes to you and asks you to check on his father who complained pain on his central chest. He looked anxious and sweating profusely. He also had difficulty in breathing. His daughter informed you that her father had a history of IHD, hypertension and hyperlipidemia. On examination, the visual signs are HR 65 beats per minute, RR 20 beats per minute, BP 94/70 mmHg, SpO2 is 90%. While you were checking on his visual sign, he suddenly became unconscious. Now I'm going with first question. What will be the information you want to know during history taking? The first thing is what type of medicine patient take for IHD, hypertension and hyperlipidemia. The second is did patient take the medicine regularly or recently? Third, the patient take any chest pain medicine such as nitroglycerin reserve. Third is before this patient facing same situation goes into unconsciously when having chest pain, and the last one is when patient have before chest pain.
Assalamualaikum, my name is Noshu Haida Asnida, my metric number MS66. Question B. Explain the impossible diagnosis for the patient in order to ensure patient having heart attack, patient required to take imaging tests such as chest x-ray, echocardiogram, computed to tomography, CT scan, magnetic resonance imaging MRI, or a nuclear scan that identify blood flow problem in the heart. Clinical laboratory tests such as electrocardiogram, EKG, or coronary characterization angiogram.
Question C. Describe the management for the patient at the scene before the arrival of medical team. First one is shake the person gently to see their response or either awake or not. And second one is if there's no response, then do for checking whether the person have the pulse is still positive. Third one, if it's still positive from the person, then proceed to perform CPR for the person. But before you start the CPR, use a towel or piece of clothing and lay it over the mouth and nose of the casualty. After that, you may start the CPR with kneel by the casualty and put on top of the first before interlock your finger, making sure they don't touch the ribs. Keep your arms straight and lean over the casualty. Press down hard to a depth of about 5 to 6 cm before releasing the pressure, allowing the chest to come back up. Fourth one, ask a helper to find and bring a defibrillator if available. And fifth one, have the person to sit down, rest and try to keep calm. Sixth one, loosen any tight clothing so that it will be easier for the person to breathing. And last one, ask if the person takes any chest pain medicine such as nitroglycerin for a non-heart condition and help them to take it. Thank you.